Call the meeting to order at 9:03 a.m. So welcome everyone. It's been a while since we've been together, so appreciate the time that you've taken out of your day to join us this morning. We have a lot of updates, a lot of things have happened since we last met, so I think we're just going to jump right into the agenda. I apologize. I didn't see the minutes come through. Did the minutes come through?
They did.
Okay, all right. So, when was that? I'm sorry, I must have missed him.
The general membership email we sent out yesterday with the Zoom link had the minutes in them.
Okay, my apologies. So, if there are no corrections or changes to that, the minutes will stand as approved. All right. I'm really excited about this next two speakers that we've got coming in. They're going to be talking to us about housing insecurity and homelessness and a broader estimate of the homelessness in Sangamon County. We have Jim Piketty and Sam Paler-Ponce from Chicago Coalition for the Homeless joining us. So without any further ado, I'll turn this meeting over to them.
Thanks so much, Val, and thank you, everybody. My name is Jim Piketty. I'm one of the Associate Directors of Community Organizing at the Chicago Coalition for the Homeless. My pronouns are he, him, and his. And I wanted to say thank you to everybody for giving Sam and I the opportunity to speak to you all about this topic. I'm going to take 30 more seconds and then hand it over to my wonderful colleague, Sam, who's really the spotlight speaker here today. I just wanted to say prior to this meeting, I had the pleasure to work with Nick and one of your grassroots leaders, Ricky Reese, on advocating down in Springfield for additional funds to help out our communities. And we were able to successfully get $75 million in American Rescue Plan Act dollars to help our communities statewide. Those are funds for capital projects for emergency and transitional housing, permanent supportive housing, as well as COLA increases for staff and providers that provide emergency and transitional housing, homeless prevention, homeless youth, and permanent supportive housing, specifically to retain staff and hire new staff. And so big shout out to Nick and Ricky, who also joined one of our team members, Sandy Dieters from Embers River Basin Agency that helps serve Central and Southern Illinois. Those efforts definitely help to lay the foundation for what we are cautiously optimistic about hearing in the governor's state budget address that was presented yesterday. And if folks are interested in learning more about that or being involved in efforts to help bring those thoughts and ideas to fruition, I'll put my contact information into chat and folks can feel free to follow up with me afterwards. So with that, I'll hand it over to Sam. Thanks so much.
Good morning, everyone. Again, my name is Sam Paler-Ponce. I'm the Manager of Research and Outreach at Chicago Coalition for the Homeless. And in this role, I manage the Homelessness Data Project, which is a federal initiative to come up with a better way to estimate homelessness. We know the point in time count isn't working for a lot of communities, and we're trying to figure out an alternative. I'm going to share my screen with a presentation. Give me just a second. Can you see my screen?
Yes.
Okay, great. So just jumping right in, time is limited. What is homelessness? Generally speaking, homelessness is a situation where someone lacks a fixed, regular, adequate nighttime residence. But what is fixed, regular, and adequate? It really depends on who you ask. So we know the HUD definition captures most sheltered and unsheltered people, people that lack a fixed, regular, adequate nighttime residence that are either staying on the street, in a shelter, other institutions for less than 90 days. That's the definition that HUD is operating off of. Pursuant to the McKinney-Vento Act, the Department of Education has a far more inclusive definition. It includes all of the HUD parameters, as well as sharing the housing of other people due to the loss of your own housing, economic hardship, or a similar reason. This we've seen across communities that tends to capture a better picture of people experiencing homelessness, because homelessness isn't linear in a lot of our communities. Some people are staying with family or friends one night and then might have a shelter bed the next night and might stay in a hotel or motel. Resources are limited in our communities, and it's reflected in how someone experiences homelessness. So why does this matter? Defining homelessness is the first step toward ending it. Accurate counts of people experiencing homelessness determine which communities receive essential housing, transportation, and public health assistance, including COVID relief funds. So these are the four main data sets we have to work with when quantifying homelessness. The point in time count, the Department of Education tallies through the McKinney-Vento Act, HMIS data, and in the US Census. The US Census is a new area where more and more people are using the US Census data to estimate homelessness that might not be captured in the point in time count or HMIS data or Department of Education data. But with all of these, we know that there are limitations. With the point in time, it's a 1-day count. And in this area, at a really cold time in the year, it's probably not reflective of all of the people that experience unsheltered and sheltered homelessness throughout the course of a year. With the Department of Education, it's only kids in school and kids identified through the school system. HMIS is only people staying on the street or in shelter, people accessing services. And then the US Census, a new area we're exploring, is we can only capture people doubling up. So Chicago Coalition for the Homeless, about 6 years ago, started exploring these bottom two as a more accurate measure of homelessness, using HMIS data and US Census data together to come up with a better picture of homelessness. So the US Census administers an American Community Survey every year. They contact 3.5 million households across the United States, and they gather information concerning the living conditions of a household. They don't ask whether or not someone in the household is experiencing homelessness by doubling up, but they gather enough household characteristic data where we can piece together what are situations that look more like doubling up and less like sharing a home or a roommate situation. So they ask if someone's formally contributing to household costs, if they have a bedroom of their own, if they fall within the traditional household structure or household composition. They ask, I think, around 130 questions relating to the housing characteristics, and traditionally, the American Community Survey is used to paint a better economic picture, the economic standing of individuals in a particular area, in addition to changing demographics. So a lot of economists use this data set. And around 6 years ago, Chicago Coalition for the Homeless looked to this as a potential way to estimate people doubling up. So strengths with this data, it's very in-depth, it's reputable. They ask a lot of questions relating to housing situations. Weaknesses, the survey collects 1 in 100 households. So for every 100 households, they survey one household, and the 1 in 100 nature has its limitations, especially in more rural areas. In places like Chicago, 1 in 100 could be 100 people in a community area, or 100 households in a community area that probably reflect what the living situations are in that area. But in more rural communities, the 1 in 100 nature has its limitations, and we'll talk about that later. There are a lot of opportunities with this data too. It's collected across the country. So there's a lot of opportunity to compare to other community areas. And threats with this data recently, COVID-19 interrupted data collection a lot. So putting it into practice, I'm going to review how Chicago has navigated estimating, or Chicago Coalition for the Homeless has navigated estimating homelessness for our city. So we took HMIS data and US Census data and combined them to create a 65,000 estimate of people experiencing homelessness. Street and shelter data, we looked at people that were accessing services throughout the course of a year and didn't report entering the homeless services system from a temporary living situation, and people that didn't exit the homeless services system to a temporary living situation. So we categorically removed people that maybe were doubling up from HMIS data, assuming that they were in US Census data. With that, we come to a sum of 65,611 people. And you can see over time, from 2015 to 2020, there's been very little change in street and shelter estimates of people experiencing homelessness, or tallies of people experiencing homelessness, because our system is at capacity. And we see this across communities, that there's very little change in how many people are staying in a shelter bed in any given night, because shelter beds we're not increasing capacity that frequently. So you can see it hovers around 16,000 street and shelter. We see huge fluctuations in doubling up, and that follows more with the trends in rent cost, burdenness of rent, and eviction trends. You can see large fluctuations in doubling up. So yeah, 49,000 people in Chicago were doubling up, and we are pushing that messaging to create a better picture of who's experiencing homelessness. This data is available across Illinois, and it's by public use microdata area. And this is a community area created by the US Census. And we have data for each CUMA across Illinois. You can see it sliced up quite a bit across Illinois in this image. So now for your county, doubled up homelessness. Due to limitations with COVID data collection, estimates are only available for your geographic region right now, which includes all of these counties. It's a pretty big area, but COVID interrupted data collection quite a bit. So doing the analysis for your community area, using the US Census data, it's estimated that 8,451 people were experiencing homelessness by doubling up at the height of the COVID-19 pandemic. And there's an age breakdown there. I'm limited on time, so I'm gonna move forward and circulate these slides after. But 8,451 people experiencing homelessness by doubling up. That's a huge difference than your reported PIT count, and I'm interested to hear if that is more reflective of what you see in your work with people experiencing homelessness. Here's a breakdown by race and by ethnicity. And this is generally reflective of other areas across Illinois and in Chicago as well. So opportunities with this doubled up estimate, you can paint a better picture of homelessness by reporting it alongside other measures of homelessness we have available, like the point in time count, McKinney-Vento data, HMIS data, whatever we have available. We can incorporate it into external messaging around homelessness and perhaps most importantly, advocate for new resources. So right now, I'm working with the Boston Continuum of Care, and they're using this their doubled up estimate to advocate for more city funding around homelessness. And more recently, in Chicago, we've advocated for a doubled up pilot program that houses doubled up families that have been cycling in and out of the shelter system, but more often temporarily staying with others. We have a pilot program of 35 units that should be launching in July, and we wouldn't be able to advocate for those new resources or these pilot programs without an estimate to work from. I'll leave it at that. Are there any questions before I end my presentation?
Actually, yes. By the data from our area, is that Sangamon County or a larger area?
It's a larger area because of COVID. COVID interrupted data collection quite a lot. So it's including all of these counties in the area that are listed on this slide, or cities and counties. That may look different in future years. Well, it will look different in future years, just because the US Census wasn't able to collect as much data with the restrictions, the COVID restrictions.
Okay.
Sam, I know the counties listed here are, they comprise of many different continuums of care. Just wondering if recognizing the names, I'm not sure, if they're complete continuums of care or not for point in time count purposes, but it'd be really interesting to try to pull together what PIT counts were for all of these counties and compare to that doubled up number. I think.
Yeah. And in the governor's budget address, it sounds like his office took that approach when estimating people experiencing homelessness across the state. He combined Illinois PIT count data with our estimate of how many people are doubling up across the state to come up with a number. It was 120,000. So around 9,000 people are captured in the point in time count, or 10,000 captured in the point in time count across the state. And that was combined with our doubled up data. And even that it isn't perfect, but it does create a better picture of who may be experiencing homelessness throughout the course of a year. Are there any? Oh, go ahead.
I was just going to mention that Jim put the link to what you're talking about there in the chat for others. So I think the people that we have on this call, they work across so many different portions of our community, and I saw one comment come through from someone who works at the Regional Office of Education, the McKinney-Vento. So I think one of the things that's helpful for us is to recognize that the issue of homelessness and housing insecurity is often much broader than what we're able to focus on through HUD COC funding and those types of things. And so I think your presentation has really, I think, helped to shine light on that, which we're grateful for.
Great. I put my contact information in the chat. Please feel free to reach out with any other questions, whether it's around a community area or geographic area or the numbers themselves. And I can circulate this presentation and other findings that we found in our doubled up research for your area. But thank you so much for your time.
I just had a quick question.
Oh.
Outside of COVID, when you compile the data from the American Community Survey, does it typically include all those communities, or is it a smaller group that it can, that you would combine, other communities you would combine us with?
So, in non-COVID times,
Mhm.
the American Community Survey can survey a lot of households across Illinois, and with that, it can be more precise. The estimate, it can be a much smaller community area. It may be Sangamon and like some a neighboring county, but during COVID, they had to combine a lot of areas.
Right. Okay, thank you. All right. Are there any other further questions, comments?
Yeah, I just wanted to say very quickly, again, thank you to Sam for presenting and compiling this wonderful both local data and the statewide estimate. Since publishing this report late last year, we have been successfully been able to use this to shift the narrative about who is experiencing homelessness and how many people are statewide. Sam referenced that our numbers were lifted up in the governor's estimation, as well as the breakdown by race on who was experiencing homelessness in his budget address that was yesterday. And when we were passing around the report, legislators from the Democrats and the Republicans were very interested in both receiving this information and being willing to have follow-up conversations. And so I just wanted to lift that up in context that this is something that we're already seeing some success in terms of shifting the narrative on both a local and state level. So thank you, Sam, and your team for putting this together. Thank you, Nick and Ricky, for helping us to already start to make some movement on this. It's been a fantastic organizing tool and illuminating opportunity to have a really worthwhile conversation with folks.
Well, thank you, Jim and Sam. We really appreciate you joining us today. Thank you so very much. All right, let's move on. Josh, will you want to give us a little bit of an update on Heartland Housed? You're muted.
Rookie move. I'd be happy to. So, as you all know, we've spent a significant amount of time over the last few years working on a strategic plan for our community. That was released early last fall, and work began, immediately on implementation steps. And a big part of that was really developing more of a backbone organization and a more sustainable way to provide system leadership for our community. And we've been working to do that, accomplish that through Heartland Housed. So Heartland Housed is a new entity in our community. You've, maybe have seen some about it, but we'll continue to be educating on it. And as you read the strategic plan, you really see the purpose behind it and really what we're trying to accomplish. So in October of last year, the strategy board hired me as executive director of Heartland Housed. In the time since then, we've been working to really establish the entity, setting up bank accounts, applying for nonprofit status, all of those types of things, and working to secure funding. So at this point, we have secured funding from Sangamon County, in the process of securing funding from Capital Township, and in conversations to do so with the city of Springfield as well. And with that, we plan to hire additional staff. So in a moment, I'll put a couple links in the chat, but if you look at the general membership email that was sent out yesterday, you'll see that we have posted 2 positions. One is a system coordinator position that will really take on a lot of the work supporting the task groups of the continuum of care and really help to propel some of that work forward. And then another one is an administrative support person that will work across all the staff at Heartland Housed. So we're really excited about that. That's a big next step for us, and I think for our community as well. And so those are some of the bigger things that have transpired. Also with Heartland Housed, just want to give you a little bit, again, as we set this up, I think, this is new. So what is this? What does it mean? Historically, prior to 2020, the Heartland Continuum of Care didn't really have any community level staff support apart from HMIS leadership. So in terms of the staff to really kind of work to pull people together and set up the meetings, there was nobody in that role prior to 2020. What we were really hoping to achieve through the Heartland Housed effort is to really add additional funding, add additional energy to all of that, and provide support for continuum of care efforts, the crisis response system, the development of a lived experience advisory board. Jim mentioned, Ricky's work. Ricky is a part of the strategy board. Ricky and others, the Continuum of Care Board, have helped us to put in place a lived experience advisory board policy so that we can, as funding allows, compensate people with lived experience for their work across our boards and consulting opportunities. So that's something that the strategy board will, and the staff will help to support. And then later in the year, we intend to launch a housing task force that really focuses on helping our community develop the capacity that's needed to really create the housing opportunities we need in the community. So just to give you a visualization of what that could look like, and what it should lead to. So part of this effort is to really look at all of the resources that are available in our community, and through education and advocacy and other work to really help align funding and resources available in our community with the strategic plan's efforts. So one way that has already materialized with your help is the City of Springfield's Home ARP funding. We've been talking about this for quite some time, and we hosted a meeting late last year where we sort of laid out, hey, here's looking at the strategic plan. Here's how this unique funding source could really have an incredible impact in our community. And we're grateful for the opportunity that we had to advocate with the city and work with the city on this draft allocation. And it was made public last week. And so I just wanted to highlight this for you. In a moment, I'm going to put a link in the draft where I'm going to put a link to the draft in the chat that would allow you to go on the city's website and comment. I'm incredibly excited about this allocation. It lines up really closely with what we advocated for at the community meeting. You can see between supportive services and tenant-based rental assistance, 1.7 million of the almost 2.4 has been allocated in those two directions, which would really allow for us to create it would give us a great jump start on creating housing opportunities as laid out in the plan, both rapid rehousing and permanent supportive housing. So again, we're excited about this. Encourage you to go to the link when I post it in the chat. And if you're excited about it too, make sure that you let the city know. Again, this I think lines up really well with what we have laid out in the strategic plan. So with that, don't want to go on too long, but as Heartland House gets up and running and as we add additional staff, we really hope that as these updates play out at general membership meetings, we're really going to put more focus on the goals of the task groups and what the outcomes of those groups are. And, again, look forward to the additional energy that's going into all of this work. With that, I'd be happy to address any questions on any of that.
Not a question real quickly though, Josh, even though I don't like inundating people with emails. Additionally, and on top of putting this in the chat, could you send out the link to respond to this? Because this is really important. HUD takes very seriously the input from the community. And so if we could get as many people to comment that they support the plan that's being put forward for the ARP funds, that would be terrific. So if you could additionally send a separate email out so that everybody has that opportunity to our general membership, I think that'd be a good thing.
Absolutely.
All right. Any questions?
About real quick to just mention that link is in the general membership that went out yesterday.
Okay.
Like that, but we'll send an email that highlights just that
Right.
as well. And after this meeting, we're also sending an email that highlights just the staffing opportunities. So
Good.
you'll see at least a couple emails from us today.
Okay. Thank you. Well, if there are no questions, you must have done a great job, Josh. There was a lot, and there's a lot going on. behind the scenes still, and we'll keep reporting that out each time we meet. Laura, if you could tell us a little bit about the Helping Hands Emergency Shelter transition.
Sure. Good morning. I was amazed when Josh said we hadn't had a general membership meeting since this was announced. So I'll just go ahead and give just a little overview in case people hadn't heard. Helping Hands is opening a new facility on Dirksen. It'll house our emergency shelter, day services, our housing programs, and our administrative offices. We're currently working out the details for the services that are going to be offered on site and working with the community on transportation. I know that tends to be everybody's first question. The shelter itself will have enough beds to meet our current capacity within Springfield. So we will be taking on the overflow shelter. And we are working with Salvation Army right now on a transition plan. So we're kind of aligning policies and procedures and doing some trainings that'll prepare both of our staff and clients for that change. Really, our goal is to provide a safe place for people to stay and then help them move through the shelter system as quickly as possible, ideally into permanent housing. We are looking into diversion and prevention services as well, working within the community. So we don't want to see a lot of people kind of warehoused in a huge shelter facility. That's not our goal. Our goal is to just move people through as quickly as possible. We're looking at hopefully late fall. The county is doing the construction on that, and we're just waiting to get confirmation on when it will be ready to open, but our goal is late fall.
All right. Thank you, Laura. Does anybody have any questions? Okay, all right. We also this morning, Jenna Fox is going to be talking to us about the Family Guidance Center's mobile medicated assisted recovery van. Hope that I got all that in there, Jenna. So we'll turn it over to you.
All right, thanks. Good morning, Val. Hi, everyone. My name is Jenna Fox. I'm an Associate Vice President with Family Guidance Centers. We're the largest MAR provider within the state. MAR stands for Medicated Assisted Recovery. And so when I speak of MAR, what I'm referencing is the medications buprenorphine, some people call it Suboxone, methadone, as well as the Vivitrol injection. I can foresee as medication evolves, as well as addiction addiction education evolves, I can see where there would be more medications in our future. Family Guidance Centers has a mobile van that is in Chicago, on Chicago's west side. And we recently in Central Illinois received the same type of grant, and our mobile van was delivered about a week, 10 days ago. The point of this state-funded grant is not for Family Guidance to be absorbing all of these patients that we will be inducing. The objective of this grant is to jumpstart individuals' recovery. We will give them a prescription until they're able to go to another provider, a provider of their choice. We have partnerships with SIU and Carle Clinic, so they will be helping the patients that we induce continue on their medication. We will also be, we also have Narcan. We'll be carrying sanitary syringes. We have fentanyl testing strips, leave behind bags, a variety of different resources that we're going to be carrying with us on the van. When we will have an armed guard on the van, she is the driver as well. Once we get our full clearance from the DEA to carry our medications on the van, we will also have a nurse And then we have a recovery support specialist that will be engaging populations and patients. Right now, we are thankful to say that we've made it to the Washington Street Mission on Mondays, and we are going to the Phoenix Center on Tuesdays. That's an ongoing partnership, and we're going to be doing that moving forward, at least for the next 4 weeks. So if you know of people in the community that are interested in jumpstarting their recovery, whether it be whether they are struggling with opioid use disorder or other substance use disorders, you can point them in our direction. Again, we'll be at the Washington Street Mission at 8:30 to 10:30 on Mondays, and then we will be at the Phoenix Center on Tuesdays from 10:30 to noon. This grant is a Central Illinois grant, so we will also be traveling to DeWitt County, Menard, Cass, Macoupin, Macon, and Shelby. I think I covered everything. If anyone has any questions, I'm open to potentially give you some answers.
Ms.
ahead.
Fox, this is Jeremy Bell from Land of Lincoln Goodwill, and I'm pleased to have heard that you have this harm reduction initiative. I work with a lot of people here who are at risk of a lot of these things that you speak of. And I did hear that you have some places for people to go, but in efforts to continue to create a safe space for people who are engaged in substance use, is there any kind of literature that I could provide for them so that they can know where to go instead of me putting them on the spot and telling them where to go, like any kind of like paperwork or advertisement or anything that I can provide to people just to set out?
Yeah, absolutely. We have flyers right now that we've developed, and I can get some of those to you, or I can send you a digital one, and just kind of keep you updated on where the van's going to be at. And then I can also get you information about family guidance centers. We also have Gateway Foundation here in Sangamon County, so linking people up with the right resources for substance use disorders.
This is Dave at Sangamon County. This one, Jenna spoke to the staff this past Tuesday at our staff meeting, did a great job. And we got to see the van as well, which is very, very impressive. So she does a great job in explaining the program if anybody else is interested. But and again, thank you, Jenna, for helping us out this past week.
Thanks, Dave. It was really fun. Yeah, I forgot to mention that. So a part of this grant is, you know, educating and anti-stigma. So if there are agencies that would like us to come and present, we're more than willing to do that. I can bring the van to do that, and it counts for us as anti-stigma related work. Got a lot of flyers, or got a lot of—
Yeah, a lot of requests for flyers. Yes, yes.
Jenna, if you
All right.
send those to me, I'll send out to everybody on our list as well. So we can,
Okay.
Yeah.
Sam, if you get me your slides, we'll include all that in a follow-up email with the link to this video.
Perfect.
Okay. All right. Any other questions for Jenna? This is really exciting. But I can see you've got, with all those counties you've got to cover, you've got a lot of work ahead of you, but thank you so much for being here and for letting all of us know about this. This is huge, 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 huge. So
Thanks, Val.
uh-huh.
We're really grateful. Thank you.
Oh, yes. I mean, we're really grateful. The community, it says something was greatly needed. So, all right. We just would like to bring your attention to some other business. Josh, do you want to go over some of these trainings that we've got that are scheduled?
Yeah, absolutely. So this one, following right up on Jen's presentation, we're grateful for the Phoenix Center and the Springfield Harm Reduction Initiative. They've made 2 opportunities available this week for harm reduction. If you didn't participate at 6 p.m. last night, you missed one. But the good news is at 10 a.m. tomorrow, there's another opportunity, and you can participate through, you can go in person to the Phoenix Center for this, or you can participate by Zoom. If you're interested in either, you can let me know and I'll be happy to get you the Zoom link or any more information. So again, grateful for Sarah and Rachel being willing to provide this training, and hope you all can take advantage tomorrow at 10 a.m. or can share with your staffs. Another upcoming training, this one is on March 8th. And so Dr. Cooley is going to provide this training on understanding and engaging with LGBTQ clients. It's going to be from 9 a.m. to 11:30 a.m. And if you would like to participate, you can RSVP to John at the email listed here. Both of this information is in the email that we sent out yesterday, so you could go through there and find out more. But also, I believe there's a flyer connected to each of those that you could download and share with others. So 2 great opportunities there. Also want to make sure you're aware, for any 501c3s in our community, we've developed a partnership with Mission Outreach, and what they've done for us the last several months is the first Tuesday at each month at this warehouse on 2400 Jack Lane, they set up an opportunity where if you need cleaning supplies, there's usually an abundance of wipe, of cleaning solution to clean surfaces, mask and gloves, and several different other kinds of items. You can go to this location and you can basically shop for what's there. I think last couple months, we've only had 2 or 3 organizations take advantage of the opportunity. I know it's not something that will go on forever, but would love to see more people. If you're spending money on cleaning solution and you would rather not spend money on it, or wipes or those types of things, would encourage you to send a staff person over to check it out. There really are a lot of items, and Mission Outreach has it set up really well for us. So I think that's on. The other thing that I would mention, we have a bit of a different schedule for general membership this year. So as opposed to sort of pulling you all together month over month and giving you slightly different updates on things, we're working to spread our meetings out, but to hopefully make the updates more meaningful to you all. So that's sort of what we tried to accomplish today, and we'll try to build on that for future meetings as well. So our next meeting will take place on April 20th. But in the meantime, at this time in March, we're going to have a public training on a topic. We're in the midst of kind of finalizing exactly what that topic is, but we'll be pushing information out on that. And if you would like to be a part of a calendar invite, I would be happy to add your email address to the ongoing calendar invite, so that, especially as the meeting is a little bit different, it's not each month, you have a reminder to join us. So if you would like that calendar invite, you can email me or you could put it in the chat, and I'll make sure that that I get it to you.
All right, thanks, Josh. So now we'd like to take a moment and see if there's any additional questions from the public, or any updates, anything your organizations are doing, or just privately, anything you'd like to know more about. We'd like to take a few minutes here to allow you the opportunity to speak. All right, Josh, anything further that you can think of?
I don't think so. I noticed that I left the point in time count. I just am seeing that on the agenda. So obviously we've had some
Oh,
data points, but it is important to, we had over a really great group, about 40 different individuals, several different, many of our organizations were represented on that. And just a really wonderful collaboration that helped with this year's point in time count. We were really grateful for the energy and the spirit that people brought to that effort. So just wanted to again say thank you and highlight that.
okay. All right, thank you. And I again want to thank Jim, Sam, and Jenna for joining us this morning and providing that information. And our next meeting will be April the 20th. And I hope that you all have a wonderful rest of your day. And
Hey,
we'll
Val.
see. Yes, Penny.
I'm sorry. I was having
Number
a
4
hard time
on our
getting.
agenda, excuse me.
Oh.
Lori, can you pull up a copy of the strategic plan and share that? Is that easy to do?
Let me see if I can find it.
Cool. I'm sorry.
No problem.
All the pressure. These are I believe, so someone correct me if I'm wrong, but these are kind of newer topics that we're starting to venture into now that we've gotten some of the other topics on the strategic plan accomplished. We've had some discussion at services.
I couldn't tell if that was an internal conversation or.
I know, I couldn't tell if that was an internal conversation or not, so.
Penny, why don't you go for it?
Yeah.
Okay. So I just wanted to make people aware that Fifth Street Renaissance does still have COVID homeless prevention funds available. And they have to have somehow been affected by COVID. Either they had it, they were taking care of someone who had it. They lost hours at work because they had it, something relating back to COVID. And it has some pretty wide open rules, so we can really help people out. So if you have people, please refer them to us. Also, I had reported some time ago that we were out of homeless prevention dollars, our regular homeless prevention dollars. We have received an additional amount of funding, so we have reopened applications for regular homeless prevention. Also, we have received some funding to keep people in hotels or motels. So this is not funding where we can take people who is currently on the street and homeless and put them in a hotel. But if they've been staying in a hotel and they are running short on funds and are facing homelessness, literal homelessness, then we can work with them to keep them there. And that program not only pays for the hotel, but also pays for some food for them. And while we're working with, or while we are paying those hotel and food, we also provide case management to try to transition them into some kind of permanent housing situation. So just know those resources are available.
Penny, could you put I see Claire just added something. Claire's with Lincoln Land. Could you put some information for contact for folks who might know of these types of unique situations?
Sure.
Thank you for sharing all that as well. It's exciting that the additional homelessness prevention funds were unexpected, but certainly needed. So that's a really exciting development that those came in from the state.
Val, can I also share real quick?
Sure, absolutely.
Contact Ministries also has some funding for hotels for people. Typically, we would do families with kids for up to 2 weeks in a hotel. We could actually get them into the hotel. So if you know of any families that are needing to go into a hotel during a transition time, we could help with that as well.
Great.
Hey,
Hey, Stacy.
all right. Thank you so much. Appreciate that. Anyone else?
I think Tracy, were you going to say something there?
Actually, I was just going to ask Stacy if their funding is like a COVID requirement type of funding.
No,
For
ma'am,
that.
it is not.
No. Okay, thank you.
Penny, for the Fifth Street Renaissance hotel resource, Penny did put a number in the chat. So just want to draw folks' attention to that if you need that.
All right. Anyone else? Well, thank you for a great meeting. Jim's asking a question.
Jim, do you want to come off mute?
Yeah.
Sure. Yeah. So I also saw a partner of ours, Fluke from Housing Action Illinois. She might also be able to weigh in on this. There was, thanks to the efforts of a group called the Illinois Shelter Alliance, we're a member of that group. But there were ETH providers, I'm not sure if there's any members here on the call, pushed with Chief Christine Haley over at the Illinois Office to Prevent and End Homelessness to free up some funds late last year, specifically for emergency and transitional housing. I believe there was a small stipulation that the funds could only be drawn down if providers were able to expand services. It wasn't able to help fill funding gaps, unfortunately. But I was just curious, since folks were talking about homeless prevention and dollars for hotel payments, if anybody was able to tap into those funds. CCH and Housing Action Illinois are trying to monitor that situation.
So Fifth Street Renaissance did receive some of those funds on a couple of different levels. We received a small amount to be able to add some room dividers so we could get our capacity back to pre-COVID. And then that's also where our hotel motel money is coming from.
Got it. Thanks for sharing, Penny.
Contact Ministries also received some, and that's where our hotel money is coming from.
Great. Thanks for sharing. Thanks all. Really appreciate the responses. And again, for having the opportunity to come and participate in the meeting and present to you all today.
Sure.
Yep. And we should, I should have said this earlier too, but if you're not familiar with Chicago Coalition for the Homeless, do check them out. Jim's got his information in the link. And again, we'll add it to the email that we send out as a recap. But their advocacy on behalf of the entire state is a big part of some of the additional resources that have been available. And I know we've benefited, just from being able to connect with them and talk through things too. So they are a great organization that's been really helpful to us.
Thank you for that wonderful plug, Josh. I really appreciate that. And so as Josh was saying, myself and another colleague, Alex, who's not here today, coordinate our state network. I specifically work with providers in Central and Southern Illinois. So if folks are interested in following up one-to-one afterwards, I'd be happy to. Please don't hesitate to reach out by email or phone. Thanks.
That's a wonderful offering, Jim. Thank you. All right. Any additional comments?
I did go ahead and add for tomorrow's 10 a.m. harm reduction training. If you're interested in participating via Zoom, I went ahead and just added that link to the chat. So you could grab that out of there or subsequently email me later and I'll get it to you. So.
Yeah. And we did have a question as to how long it was. And I believe Nick answered that it's a 2-hour training.
Thanks for all the great info today, guys. It's been wonderful.
Yeah. Lot going on, Tammy. Lot going on.
Thanks for everyone joining. We had great attendance and appreciate all of you.
All right. So we'll see you all on April 20th. But in the meantime, if you have any questions on anything, please don't hesitate to reach out. We're excited to have so much more participation. So we want to just keep this momentum going. So thank you all. Have a great day.
Thanks, everybody.
Yeah.
Hey.